Good afternoon. Thank you for joining us this week. I wanted to start by an acknowledgement of a vote that was taken earlier this morning. Happy to report that the State Board of Education has helped us reach a resolution on school funding. I've said from the very beginning that I'm fully committed to schools getting full funded for students who would normally be in the physical classroom but are attending virtually at the moment this fall due to the pandemic. And that's exactly the resolution that the State Board of Education reached again earlier this morning. A vote was taken, and the board's executive director will modify the tuition support rule to provide funding levels as anticipated for students before the development of the public health emergency washed upon our shores. And what this simply means is students who attended school in person in February but are learning virtually on the September 18th count date due to COVID-19 will receive 100% funding as anticipated before this current public health emergency. Students who attended school virtually in February and remain virtual students now will continue to be funded at that 85% level. So I just wanted to take just a few moments at the outset here to thank everyone that had a hand in this progress, and again, share my appreciation for all the input and all the commitment to getting this issue resolved so that our schools and our faculty members, our teachers, our superintendents, our parents, students most importantly, have the funding that is needed to educate students during these unprecedented times. Brian Murphy is with us today. He is the executive director that I referred to of the State Board of Education, and Chad Arani, the general counsel for the SBOE, the State Board of Education, are both here to answer any questions or get a little deeper into the weeds if you'd like. But first, Dr. Box, if you'd start us off with your updates and share with us, you rolled out the map, the color-coded map, statewide map that was going to go live today. Assuming we're on track.
Yes, sir.
Yes, okay.
Made some tweaks, but we're there.
Yeah. And any other testing and tracing updates that you have as well.
Thank you, Governor. Good afternoon, Hoosiers. Today we reported 871 additional cases of COVID-19 in Indiana, which brings to our total 95,750 the total number of Hoosiers known to have COVID. We also saw 13 additional confirmed deaths. To date, 3,106 Hoosiers have died of COVID-19, and another 219 are believed to have died from this disease based on their clinical diagnosis. Currently, 40% of ICU beds and more than 82% of ventilators are still available. Less than 11% of occupied ICU beds are housing patients who have either been diagnosed with COVID or have symptoms of COVID. As of yesterday, 887 Hoosiers were hospitalized with COVID or COVID-related symptoms. While the number is still much higher than our low of 595 in late June, I am encouraged that we've been able to preserve our ICU and ventilator capacity throughout this pandemic. That is an incredible testament to the work that our hospitals have done to increase their capacity, as well as the new ways that we're able to treat COVID patients to try to keep them off of ventilators. Our 7-day positivity rate for unique individuals tested was 7.2% as of August 26th, while our cumulative rate is holding steady at 8.8%. I also want to share our latest data on hospitalizations and recovery from our partners at Regenstrief. To date, they have looked at 91,201 cases. Of those, about 22% visited the emergency department, which is up slightly from last week. A total of 11,902 were hospitalized, which represents 12% of all positive cases. That is the same rate as last week. Of those who were hospitalized, 21% were admitted to the ICU, which is up slightly from last week. That represents 3% of all positive patients, which is also a decrease. 75% of hospitalized patients have been discharged, which is a slight decrease. Of the remaining 25%, 7% are believed to still be hospitalized. 18% are known to have died while hospitalized. Regenstrief also estimates that 79% of patients have recovered, which is consistent with last week. All of these metrics have informed the decisions that we have made throughout this pandemic. But as I noted last week, we know that counties, and especially schools, have been looking for more guidance. That's why we developed the color-coded county maps that I introduced last week. Overnight, we will be posting those maps on our website, but I want to highlight some important changes to how we are determining which colors counties fall into. The goal is to provide an easy-to-understand system that local and school officials can use to inform their decisions. The score does not trigger a requirement of action, but it provides information and recommendations. We are using 4 colors, blue, yellow, orange, and red, to indicate the level of COVID transmission in a county and make those recommendations for action, with blue being the least restrictive and red being the most restrictive. Last week, I said that the colors would be determined by an average of scores of 0 to 3 that would be assigned for 3 metrics. Those were the number of new cases per 100,000 residents in the past week, the percent positivity as determined by the number of the number of positive tests divided by the number of administered tests, and the change in the positivity rate from the previous week. As we have received input and questions from local health departments and school superintendents over this past week, we have taken a deeper look at the impact that the change in the positivity rate has on counties and realized that we needed to make some adjustments. While we initially planned to use 3 metrics, we determined that including the percent change in the positivity from week to week introduced too much volatility and wasn't truly representative of the situation in a county or the true community spread. For example, a county's positivity rate could be slightly improved, but the rate of spread could still be high based on the number of positive cases per 100,000 individuals or the percent positivity. We want these maps to be useful tools, but do not want them to give people a false sense of security when COVID is still very active in their communities. So the map that we will be posting overnight tonight will be based on 2 metrics, the positivity rate and the cases per 100,000 individuals. For the new cases per 100,000 residents, less than 10 new cases will be assigned a 0. 10 to 99 new cases will receive a score of 1. 0 to 199 new cases will score a 2, and 200 or more new cases receive a score of 3. For percent positivity, less than 5% will receive a 0. A rate of 5 to 9.9% will receive a score of 1. 10 to 14.9% will receive a 2, and 15% positivity or greater will receive a score of 3. Counties will still be able to see whether their positivity rate is trending up or down by hovering over their county, but this change will not be used to determine what color a county receives. We know that today's map looks different than what I presented last week, and we expect it to change from week to week, depending on the data. As a reminder, blue indicates minimal community spread. The recommendations would be that schools operate all grades in person, but limit activities where social distancing is not feasible. Also, extracurricular activities follow state and local guidelines, including distancing and masks, and limit spectators. Outreach occurs to encourage public to continue with precautions. The yellow would indicate that there's a moderate community spread, and the recommendations in this scenario would be that schools continue all grades in person, but increase vigilance in distancing, hand hygiene, and the use of masks. We would recommend considering no assemblies or activities occur if social distancing is not feasible. We'd recommend that schools postpone or cancel extracurricular activities as warranted and consider allowing only parents or close family members to attend athletic and other events, and that they work with their local health department to determine if increased precautions and public outreach should begin to halt the spread. A county in orange is experiencing moderate to high community spread. In this case, we would recommend that grade schools continue in person and that a hybrid learning approach be considered for middle and high school students. No assemblies or large group activities should occur. Extracurricular activities are limited and have competitors and participants potentially only, with no in-person attendees. We also recommend discussions with parents about limiting social events outside of school, and we continue to see that many cases are tied to sleepovers and parties. We also recommend that county education leaders work with their local health department to consider implementing aggressive prevention efforts in schools and communities. Red counties are experiencing high community spread. For these counties, the recommendations would be that grade schools could remain in person or consider hybrid learning, and that middle and high schools consider virtual learning. No assemblies or large group activities should be held, extracurricular activities should be canceled, and we would discourage social events. We would also, again, encourage county education leaders to work with their local health departments to consider implementing aggressive prevention efforts in schools and communities. We continue to gather the information we need for the school dashboard and are sending a survey to school principals so that they can designate a person to do the daily reporting. Our request is that schools report this information daily. Once we have the survey results back next week, we'll be able to identify any outstanding concerns and start building the dashboard. Our plan is to still have a dashboard publicly available by the end of the month, but that will require help from our schools. So please respond to the survey and identify someone in your school to run point on this data. Another one of the principles to reopening our state is our ability to conduct contact tracing for individuals who are positive and their close contacts. As I noted last week, we are on track to have more than 1,200 contact tracers around the state between state centralized contact tracing operation and the local health department contact tracers. The work these folks do is critical to keeping Hoosiers safe. They ask people who have tested positive where they've been in the days before they started showing symptoms. And they ask who you've been in contact with. That's 6 feet, within 6 feet for longer than 15 minutes or more, so that we can notify those individuals that they need to quarantine for 14 days. Our contact tracing operation also helps us to determine if there's a common exposure source, such as people who all attended the same event and then developed symptoms. Through contact tracing efforts, we've been able to identify more than 3,300 cases statewide that were connected to bars, gyms, hair salons, restaurants, retail outlets, schools, and daycares, family reunions, weddings, churches, and other places where people congregate. For example, we identified a bar that had 12 cases who visited the location on the same day, and 22 other cases were linked to that bar over a 2-week period of time. We saw an outbreak among members of a church that had 7 individuals who all tested positive, all attending on the same day. And we also know of 3 cases associated with funerals and 6 cases associated with a church camp. What this shows us is that COVID can spread quickly in large gatherings, especially when people aren't staying 6 feet apart and wearing masks. Please pay attention to that as you make your plans for Labor Day weekend. We saw a surge in patients after Memorial Day and our July 4th gatherings. I don't want to see that surge after Labor Day. Make this weekend a safe one, Hoosiers. I also want to update you on testing of our long-term care staff. As you recall, we tested more than 36,000 staff members earlier this summer. We are currently in the middle of a second wave of testing and have tested nearly 18,000 staff so far and expect to wrap up testing next week. Some staff have been tested elsewhere and aren't being tested by our team this round, but those test results will still be reported to us. Once we have the updated numbers and analysis, we'll be able to update the information on our long-term care dashboard. We're working on a long-range plan that enables facilities to do their testing in-house. More than 200 long-term care facilities have received antigen machines that will allow on-site testing of both staff and residents so that they can quickly respond to positive results. The rest of the facilities are expected to receive their machines by the end of the month. Unfortunately, COVID isn't going away anytime soon, so building plans for testing and contact tracing that are sustainable will continue to be a priority for our state. Thank you.
The doctor has spoken. The doctor is right again. Rachel, you want to jump right into the Q&A portion?
Lindsay Erdody, the Indianapolis Business Journal.
Good afternoon, Lindsay.
Good afternoon, Governor. I'm curious, is the testing that's being done at colleges, including those rapid result tests, are those being included in the state data that's being reported? And if so, how do you think that's impacting the data we're seeing? And if not, can you explain why it's not included?
So that testing is being included, and we actually just sent out a survey to all of our colleges and universities, asking them if they were doing routine screening, making sure that they were reporting all of those results to us, and asking if they would like to have their data separated. That's what we've been doing for the counties going forward. So St. Joe County and Monroe County, they like to see the data separated out. If you look online, most of our major universities have already established their own dashboard with their own data. So if you look for Notre Dame and IU, and you can see this with Purdue, I think Ball State and ISU are also on there. So you can actually look and see the number of tests they're doing, and you can see the positivity of those tests. But they are included on our tests, both the positives and the negatives, because we do believe that to be an estimate of community spread, because they are out and active in our restaurants, in our bars, in our retail establishments, and in the community.
And as you mentioned, I mean, many of the fraternities and sororities are where the spread is occurring. So it's not in the classroom, but it's back when people are naturally wanting to congregate.
Right. It's the outside activities that get us in trouble.
Yeah.
Kathy from the Ferdinand News.
Afternoon, Kathy.
Good afternoon. I have two questions.
I bet you do.
One for you, Governor, and one for Dr. Box. My one for you, Governor, is last week you had mentioned that you're speaking really frequently with our neighboring states, and I wonder how we fall within them. I don't pay that much attention to their statistics. Are they about on the same track? Are we all kind of on a level playing field right now in the Midwest? Or what is it you're hearing and seeing, and are they doing things differently?
Well, you might go into how the reporting is a little, or was a little, differently, not just consumed, but reported. But we are kind of, our region, we've watched spread come up, south, and we've watched it move east and west. But the governors that I'm speaking to on a more frequent basis, Kentucky, Ohio, and then Michigan and Illinois, obviously, we're all kind of moving in a pack. But you might want to talk a little bit about the reporting side of it, which is something I bring up with them all the time.
Right. And so one thing we did discuss, Kathy, and I think you know this, is that that's why we're reporting the additional way to calculate the percent positivity, because all of our neighboring states and the CDC across the United States was comparing states based on that percent positivity. And they were using basically all positive tests over all tests that were administered. And we were only including those unique individuals who were positive and unique tests that had been done. And that tends to make the percent positivity a little bit higher. We really did not feel that the old percent positivity, when someone had had a test in March or April that was negative, it doesn't really reflect where they are right now when they're being retested. So that's the changes that we've made, and it's really been able to, we've been able to compare ourselves a little bit more completely with our neighboring states.
Thank you. My one other question is, I know that in the U.S. they have confirmed that one person at least, and this has happened in other countries, has been reinfected. Does that negate herd immunity as a factor and lean us toward vaccination as really the major solution? Or how's that going to impact?
So it's an excellent question and really true. We've said all along that coronaviruses, some of the different strains, are the ones that cause the common cold. And we can get common cold over and over again. So the idea that we were going to let everybody just get exposed and get herd immunity has been questioned from the very beginning, and not something that we encouraged or thought would be appropriate. Until recently, we had not seen cases where people were definitively reinfected, but I can tell you that these are individuals within a 3 to 4 month period of time that once again became symptomatic and were tested and were positive, and they actually looked at the genetics of that virus and knew that that particular strain of this SARS-CoV-2 virus was a little bit different enough that it was a reinfection. So it does say that really our vaccine is something that, number one, we hope that immunity lasts over a good 6 month to 12 month period of time, but we don't know that when that comes out. And it's probably something that, like influenza, will be a repeated vaccine on at least a yearly basis.
And we just know that a lot more people will get infected, and we have a long way to go before that herd immunity. And we're learning things about this virus. I mean, you just alluded to that, and long-term damage, et cetera, to organs. And so that option, Kathy, I think is, that's the last thing we'll be dealing with is herd immunity. We gotta make sure we're managing our way through this. And back to your first point, I mean, there are some differences with our state and surrounding states in terms of capacity levels. How open are we? We're pretty much all open, and we're managing our way through this. And so those are other topics that we discuss at length, whether it be going back to school or Big Ten football or et cetera, et cetera.
Brandon Smith, Indiana Public Broadcasting.
Good afternoon, Brandon.
Good afternoon, Governor. Good afternoon, Dr. Box. Dr. Box, I first wanted to ask you a question about the testing of college students. I know that I was talking to some folks at Regan Street who talked about how those were reported by county, and they noted that in a lot of cases, it's whatever address the patient, in this case the student, gives. So some of them might give their address at the university. Some of them might give their home address, which could be somewhere else in Indiana or even outside of it. So are we worried that we're not really capturing this notion of community spread when we're not exactly sure where the person is?
So I will say that, first of all, most universities and colleges have identified where their students, especially if they're symptomatic, can go and get tested. And when they've done that, we have made sure that those individual students and those testing sites know that we want their local address. So could there be mistakes made? Most certainly. Hopefully we'll be able to pick up on that by the fact that it is an out-of-state person, and as we notify out-of-state people, we'll find out that they are locally going to school here in the state of Indiana. But we really have pushed that information and drilled that home with our universities and all the testing sites that we want local addresses for people. So we really believe that especially these counties that house our colleges and universities are very in tune to that.
Meredith with WLFI.
Meredith, good afternoon. This is where Rachel says, Meredith, you need to unmute your phone.
We'll come back to Meredith. Julia, Wish TV.
Afternoon, Julia.
Good afternoon, Governor. I have a question about the federal eviction moratorium that's set to take effect on Friday. One, does it appear to be enforceable here in Indiana? And two, are you taking any steps to inform eligible renters?
Yeah, Jake, you might want to step up to the mic, so to speak. But we've received, I think, Jake, you mentioned about applications for the original $40 million, and we're obviously, Julia, poring over the latest from the administration on evictions and how renters need to reconcile that or work through that with their landlords. You want to just give a kind of a 24-hour later reaction to, one, the administration, and two, where we are and where we may need to be in the future as well as the applications are processed.
Sure. Let me give a quick update on our rental assistance program. The application deadline was the August 26th. And on that, we had over 36,000 applications. As of close of business yesterday, we had made payments on behalf of renters to landlords of over $14 million. And we're continuing to issue payments every day. Yesterday, the U.S. Department of Health and Human Services Center and the Center for Disease and Control and Prevention issued an agency-wide order to temporarily halt residential evictions to prevent further spread of COVID-19. And under this order, a landlord shall not evict any eligible person or household from any residential property starting on September 4th through December 31st. However, the household still may be evicted for other lease violations within their lease. So I probably should mention a few things here in terms of the eligibility of this eviction moratorium that is currently in place. And I should also mention that we're currently evaluating the agency's order because it did come out just late yesterday afternoon, so we're still going through it, and it's about 37 pages. So currently, to be eligible for the eviction moratorium, a resident would have to self-certify under penalty of perjury, and there's 5 different types of eligibility criteria here that they've laid out. First, the household has to its best efforts, obtain all available government assistance for rent or housing. And then the household needs to either expect to earn less than $99,000 annually for the calendar year of 2020, or if they had a joint tax return, that income would be $198,000. Or they was not required to report any income in 2019, or they've received an economic impact payment or a stimulus payment under the CARES Act. The household is also unable to pay the full rent or make a full or housing payment to the substantial loss because of the substantial loss of household income or compensation of hours that have been reduced. There could be a layoff, or there could be an extraordinary out-of-pocket medical expenses that the household may have experienced as well. And then the fourth eligibility criteria is that using the best efforts to continue to timely make their partial payments that are close to the full payment every month as possible for the individual's circumstances. And then the final criteria is that the household, if they were to have to leave, would be determined to be homeless or be forced to move into and live in close quarters in a new congregate or shared living space. And they have no other means for any other types of housing opportunities available to them. So those are the 5 criteria for renters to be eligible for the eviction moratorium that is going to be in place on September 4th, and that will run through the end of the year. So I should mention this, as we've always mentioned this, is that renters, even under a moratorium, are still obligated to pay their rent. And they must comply with all the other rules and obligations that the household has in place under their lease agreement. So that's kind of where we are, and that's our understanding of the CDC's agency order on the eviction moratorium that they put in place, and it will go into effect on September 4th, Governor.
And once again, you said 36,000 applications have been processed. You're up to $14 million.
We have received 36,000 applications, and we have made payments on behalf of renters to landlords of $14 million. Okay. So yeah, and we're still going through those applications, and I think we're going through them at a pretty good rate. And again, I'll just want to mention how proud I am of the Indiana National Guard, who have also provided assistance in helping us review those applications as well. So
thank you both.
Steve with KPC Media.
Afternoon, Steve.
Good afternoon. How are you doing today?
Doing good. Yourself?
Good, good. 2 questions. I hope Dr. Dan is there because I'd like to just get an update on, we've heard some conflicting information about what's allowed or not allowed with nursing home visitation. So I was wondering if you could just kind of give an update on whether that's allowed, not allowed, case-by-case basis, if there's certain requirements, things like that. And then for Dr. Box, a question about quarantines. We're running into some questions about schools with students who are exposed, not students who are positive, but students who are exposed and put on quarantine at home, as to whether other siblings, their parents, other people in the household should also be quarantining at the same time, even if they haven't necessarily been directly exposed. I know we've talked in the past about where do you end with close contacts with people, but one of our school districts was reporting 50% and more of their population was out due to these kind of branching quarantines. So I was wondering what's the best practices on for households where a person has been exposed, should the other people in the household also be quarantining with them?
Yep. First, we'll go to not Dr. Dan, but Dr. Lindsay Weaver. You'll quickly notice this is not Dr. Dan. And you want to answer Steve's first question, and then you follow up on his second.
Right, so we've been working closely with the nursing homes throughout this entire pandemic, and actually opened up to outdoor visitation in early June, and we were one of the first states to be able to do that. Work really closely with them about what is the infection prevention measures, look around that, and how can you do it in a safe way, because we really felt it was very important that these people in the nursing homes have the opportunity to see their families, and we also knew it was really important for their families and loved ones to do so as well. So as of July, we also allowed indoor visitation, and again, worked with our infection prevention leaders to help us develop recommendations and regulations around how they can do that in a safe manner. So both of those are out there right now, depending on what's going on in the community and also what's happening in the facility. So if the facility is currently having an outbreak, then of course visitation may be restricted in certain areas, or if a community currently has high numbers, they also might limit their visitation depending on what's going on there.
Thank you, Lindsay.
Thanks, Lindsay. So I know the quarantine has been very frustrating for schools. It's been very frustrating for families, and I know that this is a difficult situation to work through. What we know is that individuals that are at highest risk to become infected are when they're living with another individual that becomes or is positive. So when we know that a student or a parent or a sibling of someone has been in very close contact with someone that tests positive, we know that individual needs to go home and quarantine. And the concern is that because that individual can certainly become symptomatic and would be infective the 2 days or 48 hours beforehand when they were not symptomatic, that it is important to keep other family members at home at the same time. And I know that adds up in numbers and it is a concern, which really underscores the importance of what we try to say every day, and that is really limiting that exposure by cohorting students, by doing the very best you can to socially distance those students 6 feet apart, by emphasizing the need to have that mask on, and by making sure that students, when they are waiting for results of a test, when they are symptomatic, when they are a close contact, that they stay home and don't risk exposing others.
Abdul Hakim Shabazz, Indy Politics.
Afternoon, Abdul.
Good afternoon, Governor. Good afternoon, Dr. Box. A couple of questions, Governor. First of all, on the issue of school funding, why give, obviously I can understand giving schools the 100% of their funding, but why not do the same thing for virtual schools? Why do they only get 85%? What was the logic in that decision? And my second question, Governor, particularly for you, is Chicago is looking at putting on a travel ban from Indiana because of the high numbers of COVID-19 cases. What is your thought, your reaction to that?
Brian, you want to talk about the definition of virtual, the original intent?
My name is Brian Murphy, the Executive Director of the State Board of Education. And looking at virtual schools, those in statute are funded at 85% of the basic tuition support, which is the tuition support that goes per student. If students are brick and mortar, it's 100%. And so I think what the question was getting at is the carve out for schools that are 100% virtual, and that those students will continue to receive 85%. The reason is those programs, number one, are built out versus, a traditional public school that is trying to build out programs that they're not typically used to doing in the general sense, because they teach face-to-face instruction. And so the carve-out really is to ensure that we are properly funding students that are virtual due to COVID, but we're being fiscally responsible in not funding true virtual students that would be virtual regardless of the pandemic.
Thank you, Brian. And you may want to comment on this as well, but I completely understand where our neighboring states are coming from. I'm concerned about, positivity rates, et cetera, where they're coming from. I was pleased to note that they've recognized where some of our rates are surging are actually contained on college campuses. And so that may have spurred their interest. But I'll tell you, Abdul, because you've got some family roots in Illinois, I'm not going to turn away any of the business that's coming here from Illinois and growing roots in our state. So we look forward to continuing to work with our neighbors. And you might want to talk about if with your discussions with health departments where their concern was originating from.
Right, so we work with health departments that are right across the border, whether that's down in southeastern Indiana, around Clark County and Harrison County in that area, close to Louisville, or whether that is in Vanderburgh County or in northwest Indiana around the Chicago border. Most certainly, when we have things a little more open here, we do see people coming from other states. Not only they're working here, but they're coming here to enjoy the restaurants or the other activities. We expect that they will follow the same rules and regulation with regards to social distancing and wearing their masks. And we have discussions with local elected officials and public health officials from those areas all the time to make sure that we stay along the same lines, and we have discussions back and forth when they're having particular concerns. I think that when you limit travel, that's a very hard thing to limit. Oh, if you went to Indiana and you come back over the state line, now you're going to be 14 days quarantine. Who's going to follow that up, and who knows that that actually happens? I think that, some other businesses and work, if you travel and you come back now, if you work in a hospital system and travel and come back from an area where there's a high number of cases, they're asking you to quarantine before you come back. So certainly it's impacting daily lives, but it's not something that is being regulated or looked at every day.
Justin with the Westville Indicator.
Afternoon, Justin.
Good afternoon, Governor. We've seen some school corporations in our coverage area take their discussions about their COVID-19 response and reopening plans into closed-door executive sessions rather than having these conversations in public meetings. This has frustrated some parents who have opinions on the local response. One school board spent over 2 hours and 40 minutes in executive sessions in the past month and only 24 minutes in a public meeting, and is yet to release a revised reopening plan to us despite it being approved in a public meeting. What would you say to school officials who are trying to avoid public scrutiny of their response to the pandemic?
Well, we're very transparent around here and very open about sharing the data that drives our decisions. I can understand local communities wanting to make sure their ducks are in a row and then providing that opportunity for the public to express their input. It's obviously our schools have to be mindful of parents' wishes. After all, they're not just their students, the children are theirs, but they're also the taxpayers. So I would encourage those discussions to allow for a full airing of the decisions that are being made and seek input from the community. I don't know if you want to add anything to that or.
Well, and I think it's important to have an open dialogue as much as possible. I think that there are times when you have to discuss things as an organization, but as we go forward, just like with our map, as we talked with superintendents and principals and we talked with local health departments, you have to be flexible and resilient. I mean, change has certainly been probably the norm rather than the exception.
Whitney Downard, CNHI.
Afternoon, Whitney.
Good afternoon. I know Dr. Dan isn't there, but I'm certain Dr. Box can answer my question since ISDH licenses nursing homes. So I've been reviewing a lot of surveys, past surveys of nursing homes, and I've noticed there's kind of a couple homes that have consistently performed poorly. Families were locked out when we had to close nursing homes down, and surveyors were only looking for infection control violations and trying to help guide the coronavirus response. Is there any concern about how homes were performing, whether or not the standard of care declined for those residents during those months when nobody was watching?
So Dr. Weaver is back at the podium.
Yeah, so we have been in the homes since March. So even though they weren't conducting what you would typically call a survey, they were there. They were practicing infection prevention. They were reviewing how the residents there were being cared for and making sure that everything was in line. We are back to doing surveys. We're going to review any complaints and follow up on those throughout the end of the year and kind of get back in that schedule of the regular surveys. But we never disappeared, and we were always there, honestly, marching side and side to make sure that we are taking care of everyone.
And I think it's important, back to your point, I think at the very first press conference, you were asked the question from someone in the media, what is your number one concern? And you said our long-term care facilities. For good reason, because that's where these, many of our underlying health conditions reside.
Exactly.
so
There's
this
a reason.
population,
It's our more elderly population. They have more underlying health conditions, and those are the individuals that we know are at most risk to have serious illness or death.
but Dr. Weaver said it best, and that is, we've never gone away. We never, we got, if anything, got closer and in all 92 counties at every facility.
And we still actively engage with complaints and concerns that we
Sure,
had
yeah.
from families about the fact that they couldn't reach their loved one, they couldn't talk to them, they wanted to video or FaceTime with them, and the concerns that they had. So we were very actively engaged and still talking with them and going into the long-term care facilities, making sure that those needs were being met.
Meredith with WLFI.
Second time's a charm, Meredith.
Can you hear me now?
Yes, perfect.
Perfect. Sorry about that. I'm using a different computer, so every time I do this, I have to use a different one. So
I can
you know
relate.
how that.
I do know how that goes.
So I have two questions for you. So the CDC has asked for an extension of the moratorium until the end of December for renters. I'm wondering how that affects us here in the state of Indiana. Will evictions that have already been filed still be tried in court, and will this affect the landlord mitigation program? And then I also have another question for you after that.
I'm going to ask Jake to rewind the tape and repeat, rinse and repeat. You may have been offline, Meredith, but Jake, just if you could, just give a quick recap.
Sure. Thank you. Thank you for the question. Yes, yesterday the U.S. Department of Health and Human Services, CDC, did implement or issue an agency-wide order to halt evictions, residential evictions, starting on September 4th through the end of the year, December 31st. So there are 5 different criteria currently for renters to meet in order to be eligible for that. It is only for non-payment of rent, which I think is important to remember. And it will be implemented and handled at the local eviction process through our local court. So I don't think that it really impacts the existing program, because there could be other lease violations that could cause an eviction. And in that situation, we still want to ensure that the renters and the landlords are having a conversation to use eviction only as a last resort, and there might be a way to mitigate those types of evictions, even though they're not for non-payment of rent.
And you made mention that you've received yourself, our agency or authority, 36,000 applications, 14 million so far processed.
Yeah, as the deadline was last Wednesday, we had received just over 36,000 applications that we're still in the process of reviewing and processing them and following up with landlords to get the information that we need so that we can make the payments. But in terms of payments that have gone out, we have made over $14 million in payments directly to landlords on behalf of renters across our state.
Thank you, Jake.
Yes.
Meredith, you said you had a second question?
Yes, I do apologize for the repeat question.
Nope,
My
no problem.
computer is kind of freezing up on us here today. But my second question is in regards to President Trump having discussions with Big Ten commissioners about immediately restarting the season. I just want to know what your thoughts are on that. Is there any worry that if that does happen, that our state could become a hotspot, since we do have Big Ten schools here?
Well, I think everybody wants to see football return. I certainly do, but I'll leave it up to the Big Ten to make that decision. I'll stay in my lane.
Stephanie Wade, RTV.
Stephanie, good afternoon.
Hello, good afternoon. So today's question's for Dr. Box. It's about the antigen machines received by long-term care facilities. Are those from the federal government, and why are they so important in terms of outbreaks?
So that's a great question, and yes, they are from the federal government. I think we said 20 of our long-term care, or 200 of our long-term care facilities had received them already. The ideal thing about a machine like that is that you can get a result back very quickly. If it's somebody who's symptomatic and it comes back negative, they probably still need to have additional testing done, because it may be a little more sensitive and may be picking up on it. But if it's somebody who tests positive, we know immediately that that individual is positive. We know immediately that we need to cohort that individual and separate them, whether that's a staff member or a worker there or a resident of the facility, and we know that we need to do additional testing. So the ability to have that on site and be able to respond very quickly makes a big difference versus that 24, 36-hour lag period of sending a test away.
And a less expensive way to do that initial screening.
Rob Burgess, the Wabash Plain dealer.
Rob, good afternoon.
Good afternoon, Governor. Dr. Box, late last month, the CDC issued a report stating only 6% of deaths have COVID-19 as the only cause mentioned. I've been getting some questions about this from my readers, and I think what a lot of people are taking away from that report is that the other 94% would have died anyway, and not that they died when they did do a combination of COVID and the other underlying comorbidities as contributing factors. And I was wondering if you could expand on that.
I think there's about 4 doctors that can expand on that.
Yes, it's an excellent
Good
question, and boy, has it been misinterpreted by social media. You know, the National Center for Health Statistics puts out a data report every single week for the CDC, and on August the 26th, the one they put out was basically surrounding what death certificates say about deaths from COVID-19. In there, they mentioned that 6% of the death certificates had only COVID listed as a cause of death. So automatically, some of the social media individuals decided, well, the other 94% did not die from COVID-19, so that instead of having 180,000 deaths or over that in the United States, we had 9,000 deaths from COVID-19, which is absolutely incorrect. It would be like saying that someone that had cancer came in and died of a complication maybe of their treatment that they were receiving, or lung metastasis or brain metastasis, but they also had hypertension or diabetes on their diagnosis of the death certificate, so they didn't die of their cancer. That is absolutely not true. We know that physicians and healthcare professionals put down what they see as causes or contributors to an individual's death. So someone who came in and died of COVID-19 might also have been at higher risk because they had underlying heart disease or lung disease or diabetes or underlying renal failure, but that does not mean that COVID-19 was not a contributing cause to their death. And that's one of the reasons that in the state of Indiana, we're very, very careful. When we get a report of a COVID death, we, number one, confirm that there was an infection with COVID-19 by finding that lab report and attaching to it. We look at the death certificate and we see what the healthcare professionals have put down as the causes of death. And at the same time, we make sure that if there is any questions about that, we review that with the healthcare professional. And we've actually separated those deaths that don't have a positive COVID test and called them probable deaths, because we know that some of our healthcare professionals are confident that an individual's death was related to COVID based on their clinical course and based on the imaging studies and other things that they had done in the hospital. But if we don't have a positive test, we put that down as a probable COVID death.
Does any other doc want to get anything off their chest? Or this is your opportunity. I got one. Okay. Dr. Sullivan. I saw a lot of head nodding when you were speaking.
Yes, absolutely. So I'll stay as a recovering academic researcher that Hoosiers should be incredibly proud of the data team that's worked across agencies, academic centers, and the rest to build out the process for determining COVID deaths in the state of Indiana. I would be hard-pressed to find any state that does it with as much rigor as is done here at the State Department of Health and the teams. Specifically, there have been questions asked, for example, if someone dies in a motorcycle accident and they happen to have COVID-19, do we count that as a COVID death? And the answer is no. This is done very appropriately. Comorbidities are really important to understand that that's all of us. Those are things like high blood pressure, heart disease, asthma, other things that make us at higher risk for death and mortality and morbidity. So you should have complete confidence in the way that Indiana reports its deaths. We are very transparent, and I think if you looked at the pathway to have a COVID death reported by Dr. Box, it is extraordinarily thoughtful with multiple layers to confirm and make sure that you're getting the right information.
Thank you.
Tom Davies, The Associated Press.
Hi, Tom. Good afternoon.
Good afternoon, Governor. At the last update, the state still had $1.4 billion in CARES Act funding that you haven't committed. How important do you think it is for Congress to pass additional state relief or loosen the rules on spending that money? And if so, what are you doing to push Congress to do so?
I do think it's important, especially for and Chris, you might want to chip in here, but I do think it's important, especially for your latter point about flexibility. As we've been working with our local partners throughout the state of Indiana, trying to make sure we're meeting their needs, whether it be a local health department or a local government that's had COVID-19 expenses, or our hospitals, et cetera, we have determined, and you might want to just give a figure amount of making sure by the end of September, if we don't see anything come out of Congress, that we're still in fighting shape to get through this on our own. And so that's why we have been very careful, very thoughtful, very methodical about these disbursements and the allocations. But yes, Tom, I've not just written letters, I've talked with, as of earlier this morning, had a great conversation with Senator Todd Young on this topic. And so we're all oaring in the same direction. They'll go back next week. The Senate will go back next week. And then hopefully by the end of September, we'll get some more good news. You want to just dive into, I mean, he mentioned 1.4, but you want to just kind of give a thumbnail sketch or a high-level sketch of what we've gone through and what we have left.
Okay. One of the things that I may direct you to, Tom, is not only has the OMB made a couple of presentations to the State Budget Committee and will continue to do so over the course of the next few months. We also have the obligations or the programs that have been established, of which there's probably 10 to a dozen different programs with state agencies spanning the Small Business Restart Program, the PPE Marketplace, workforce programs. Jake has talked about the rental assistance. So those various programs on their own have allocated or obligated about $1 billion out of the 2.4. Then there's also additional expenses of which we're still continuing to get guidance from, as recently as Friday, from the Inspector General of the U.S. Treasury. We received about 70 questions taking up 20 pages of how we're supposed to account for as well as administer the funds. So that continues to change, and we react to that. As the governor mentioned, the recovery team has been very deliberate in how we use that money. There are still programs that are under review. There may be a continuation or working with the rent assistance program as an example. And I think the most important thing that what we're hearing from our sources out in Washington, D.C., is not so much necessarily additional federal assistance, but one key factor is extending the timeline. Right now, the expenditures or the costs need to be incurred by December 30th of 2020. And I think that sounded good back in March when there was a lot of speculation, when the thought was the immediate needs could be taken care of in the next 4, 6 to 8 months at that time. What we're seeing now is these needs are going to continue for many, many more months. And so I think that's a realization that is being considered out in Washington, is that extending that date and being able to use this money for a longer period of time is going to help both states and local units of government.
With flexibility, yes.
Brock Turner, WFIU.
Good afternoon. Thanks for joining us.
Good afternoon, Governor. I have one question for you and then one for Dr. Box, or possibly Dr. Weaver. I'm not sure who wants to tackle this one. But moving forward with testing for nursing home staff, I know that you hope to wrap up this current round of testing for nursing home staff, I believe, next week. But the state is falling short of the federal guidelines released August 26th, stating that at minimum, residents and folks working in those facilities should be tested at least monthly. What's the plan moving forward to try and beef up testing? Is there a plan to beef up testing? And also, who pays for that testing? Is that going to fall on facilities, or does that fall to, or is the state going to help supplement that?
Right, so we've been working really closely again with the long-term care facilities and the associations to make sure that we support testing there. So we've been doing that through strike teams, making sure that we immediately responded whenever there was a positive in the facility and providing testing to staff and residents when needed. In addition to that, we've also done now almost through 2 rounds of just general screening testing for all the staff in long-term care facilities across the state of Indiana. And then as you mentioned, moving forward, CMS has come out with rules around regular scheduled testing based on the percent of positivity within the county and also whether or not they currently have an outbreak. So they are supplying the long-term care facilities with funding for that, as well as they're giving them the antigen machines to be able to provide some of that testing. However, we're still going to continue to work really closely with them to make sure that they can secure the testing that they need, whether it be through the antigen machines and also connecting with labs. And so that's what we're actively working on right now, because we don't want anybody to not be able to do the testing that they need.
Eric Berman, WI.
I think he had a second question. Are you still on, Brock?
I am, yeah. I just wanted to follow up on that. I mean, do you expect that we'll reach that new CDC guide or the new CMS guideline is that a guideline that you think we will hit, and if so, when?
So yes, I do think that we will get there. It'll be, so some of the long-term care facilities won't receive their machine until the end of the month, and that's really when they're going to be able to do that quick point of care testing. But through our efforts here in Indiana, where we have invested in the lab testing network and made sure that we were constantly increasing our capacity, I do believe with that and working with other lab partners that we'll get to a place where the labs, where the long-term care facilities are able to test on the mandated, regular basis, again, depending on lots of different situations, how frequently that actually occurs.
Eric Berman, WIBC.
Afternoon, Eric.
Hello, Governor, and my thanks to Rachel for the cue to be ready to unmute. I have 2 questions for you, actually probably both for Dr. Box. Governor, you mentioned this in connection with the Chicago travel ban question. How much of the increase we've been seeing in cases and positivity the last several days is tied to IU and Notre Dame and the other universities coming back?
Certainly, having our universities and colleges back in session and having students on campus has contributed to our positive cases. I'm sure that having students in school has contributed to some of our positive cases. Again, when we look at that, what we find is it has less to do with the going to class, getting your instruction and coming home, and it has everything to do with what you do after hours or on the weekends, as evidenced by the fact that it's not our elementary kids that are having the problem as much as our 14 to 29 or 30-year-old students that are having more issues. And so really kind of recognizing those social activities. I think that, we have talked a lot about the fact that it would be really good as parents for us to help our teenagers to identify their bubble, their group of friends that they're going to hang around with, not their 200 best friends, but maybe their 4 to 6 best friends that they do things with, like video games, watch movies, whatever else. Still socially distancing, still making sure that they're wearing their masks when they're not socially distancing. But those are the ways we can kind of help families to still allow their students to have that social emotional interaction that they so desperately need, but still help to protect the spread of this disease.
Our final question is from Nikki Kelly. Oh, no.
Nikki, please hold. Eric, did you have a second question?
I did, and it's a follow-on from the first one, and I hope we can still squeeze Nikki in. You mentioned at the beginning what you've mentioned before, which is that Labor Day is coming up, and that's a concern. Beyond just stating in this forum that that's a concern, is the state doing anything proactively to try and prevent a surge from that?
So as you're probably aware, we have a limitation of gatherings of 250 or more, and our local health departments have been looking at any gatherings that size or more and making sure that, or less, and making sure that they are weeding out those ones that individuals are openly saying we can't social distance and we can't wear masks at this. And so they are working within their communities and their counties based on where they are with regards to community spread to change some of those.
Nikki?
Hello. Just 2 very quick. First, I wanted to clarify on the color-coded school map.
So there is no level of virus spread in which the state is recommending closure of all in-person instruction. Clarify if that's accurate.
We did not say that especially elementary schools have to close completely, regardless of the level.
And then just in general, obviously you guys have had an immense amount of data for Hoosiers. And I'm just wondering, is there any concern that public is maybe getting lost in some of the numbers and not paying attention to the core messaging? Just what do you think about that?
I think it's a really good point, and that's why the public, can look at a map and see what color they're in, and that can give them some direct, like, hey, blue, yellow, orange, or red. But for those individuals who want to dive deeper, who really want to understand that we're not only looking at the number of positive tests per 100,000 or the percent positivity, and we're looking at congregate living settings, we're also looking at whether that percent positivity is going up or down, and we're looking at the number of tests that are being done per capita. All of those things enter in, and we do have a lot of data individuals who are very interested. But I think that that's why we are trying to give some direction in the form of a map with a color-coded system that's more basic so that the average person can really look at that and understand the importance of saying to their kids, put that mask back on or you're not going to have your friends over.
Yeah, and I would just say, Nikki, I mean, you're touching on a topic that we've discussed a lot, and we don't want folks drowning in a sea of data. But we also know that different folks consume information differently. And so we're going to constantly err on more rather than less. And in this regard, a map is very easy for me to follow. I'm a visual guy. But we also have a lot of supporting evidence, and we'll continue to work in every way that we can to educate that it's we're going to get through this a lot swifter and safer if we're acting proactively and not reacting to these event-driven. Where you have events that are like moths to a flame, that's where not good stuff happens. And then we're having to clean up after the fact. And we can surge very quickly, and as you noticed, if you follow this, all the information that we put out, it takes longer for the trajectory to bend down. That's why we said at the very outset that we got to slow the spread, and it requires us to be vigilant every single day.
Thank you for joining today's briefing. Governor Holcomb's next briefing will be next Wednesday at 2:30 p.m. Eastern.